So I've seen in movies, right? They always say that dental doctors are not doctors. What is your take on that?
Well, we trust me, right? In Hangover, whenever that happens, all of the dentists are like, that get offended by it. They actually are doctors, though. They're the doctors of the mouth. And in all honesty, it really is kind of upsetting because it's like people think that the mouth is separate from the body, and it's like it's not. They're all one, so they're just the doctor of the mouth, of the oral care. And, you know, more and more now, your mouth is connected with your body, right? And people are learning that, like heart disease, pancreatic cancer. The ones that I love to get the guys with is erectile dysfunction, ED, and that was like, oh yeah, I'll do whatever with my teeth, right? Because if you, but the truth is the bacteria in the mouth causes an infection, causes inflammation, which then causes the bone loss around the tooth as well, which ultimately leads to tooth loss. But that takes a really long time for that to occur. But in the meantime, if your body carries this active infection all the time, right, in your mouth, and it's never, calms down to a level of health, then all that bacteria gets into the body and it impacts it, in ways of inflammation throughout the rest of the body. And so that impacts the liver, it causes people to have issues with diabetes. Not taking care of the mouth also impacts people being able to have birth. A lot of them end up with preterm labor, and or I've had some of my own patients when that would say they struggle with as far as coming in and saying that they struggled with pregnancy, right? That they just couldn't get pregnant. And then literally we finally got to the root of their problem, which was their oral health and the inflammation in their mouth, got them nice and cleaned up, gave them good, home care. And they were then able to get pregnant. So, I mean, and the science is there. The same plaque that's in our mouth is the same that we're finding in Alzheimer's patients. So, the fact that for some reason it's like, hey, you're not a doc, right? It's like, well, yeah, we are. And we also, it's a really important piece is that we're much easier to take a look inside you than somebody on the other end. So just come in, open wide, and have a fun time with us and let us check it out because there's a lot of things that we also can, find out in the mouth just by looking at the tissue. Like people don't even realize like your tissue is going to respond differently. There's lots of things that we can, somebody has acid reflux. We can tell that, typically in the mouth, there's just so many things that we can really identify if we'll just slow down and look. And if we get everybody to go to the dentist on a regular basis too, that would
That's
be,
that's that's very interesting. I didn't know so much. You can say so much just by checking someone's dental hygiene and the bacteria in the mouth. I swear I didn't know this. Again, forgive me if this question is too much or it's coming out of ignorance. So can you, if that's the case, why don't doctors use dental as the main preventative care? Like if you say, oh, I can see the bacteria in the mouth and I can say,
yeah,
okay,
yeah.
this
Well,
is
and you
what
can
that is.
test so much from saliva, right?
Mm-hmm.
Too. Like if you test saliva, there's a lot that you can test in it that will tell you like the health of the individual that's in front of you.
Mm.
I think that that's beginning to change where we're seeing more medical doctors and dentists work together to be able to care for a patient long term, especially when it comes to like patients that have cardiovascular, issues, right? The doctors, we know that that plaque and that bacteria gets into the heart and can cause infection and cause issues. So, you know, more now than ever, those two, they're talking, right? We're starting to have, the different doctors and dentistry, they're starting to merge together. And really, we're seeing dentistry move away from what we used to be, which was, the drill and fill, right?
Mm.
That was kind of
Mm.
like we waited, we watched stuff. Do you ever hear anything about like, oh, you have we'll watch this area, right? And I
Mhm.
always, being, years ago when I first got in dentistry, I was like, what do we do? What are we watching it for? And they're like, oh, we're watching it for it to decay. And once it decays, then we'll fill it. That's
Mhm.
dentistry. But that's really changing because of technology. And this year's the first year we have a dental code that we can, your insurance carriers and people, will take care of, which helps, everybody with their benefits. But it's this newer product that, or technology, shall I say, it's a polymer that we lay down on the tooth structure and it actually grows enamel back.
Wow.
So it's really cool. And like, I have the shirt I wear a lot and it says the drill free future. And I believe that because, like, if we can treat disease earlier, right,
Mhm.
preventative, right, not that drill and fill model, what you were saying, if we can do that earlier, then that is more like the medical model. Because the medical model, right, we try to prevent disease versus dentistry was always like, well, we'll just wait. We'll just wait till it decays. We'll wait till that pocket's deeper. We'll wait till that tooth has lost, half of its bone and then we'll discuss it. Because that was the mentality, is like, it wasn't as preventive as it is today. Now we're much more aggressive and trying to treat disease sooner than later, because we also know that if we can help you maintain your teeth, then you're for a longer period of time, you're also going to live longer and you're going
Mm.
to be happier. You know why? Because smiles are a connection between you and I right now,
True.
right?
True.
It's I tell people all the time, and my mission is like, you can change the world with a smile. And that's, I work with a lot of different hygienists, and that's the one thing is I hope I instill in them is that, like, really, you can change the world being a dental hygienist. And that's why I wanted to be a hygienist, because I know the impact of a smile. It can light up your day, right? You can not meet somebody ever before, like Ragu, you and I. It was your smile, right? It was you and I. We were sitting there having a drink, chatting, and we had Erica, who's always
Yeah.
bubbly and wild. I love that girl. She is so good at what she does. And I am so lucky to be able to work with her every day, because she literally is the best of the best, regional hygiene and specialist that, or trainer. I mean, you name it, that she's everything when it comes to hygiene, and like, she's just a gem to work with. And my whole team, I have had my whole team there whenever we met, but yeah, she is definitely, um, she's a hoot.
She is. She is.
You definitely
Um,
remembered her.
I definitely. She's one of a person whom I can never forget. That's how impactful she is. She's super sweet though.
Mhm.
So, I mean, talking to you, I have